to our slide presentation. And let's look at some stuff here really quick. I want to do a really quick little review. Miss Cooper, are you there?
Yes.
Miss Cooper? Can you see my slide?
Mm-hmm.
What is that muscle?
We went over it yesterday, but
yes, we did. That's good. I'm not trying to. And by the way, I'm not trying to pick on you. I'm just trying to drill you so that we're going to learn it. If you don't know it today, well, I'm going to ask you every day until you graduate. So don't worry about it. But any idea what this diagonal muscle?
Anserinus.
What now?
Was it part of the anserinus?
It inserts into the pes anserinus on the medial proximal aspect of the tibia, down there below the knee. That's true. It inserts in the pes anserinus, and its origin, I think its insertion is pes anserinus. Its origin is the anterior superior iliac spine. It crosses two joints. It does three actions.
Rectus femoris.
Flexion. The rectus femoris runs straight up and down the leg, and it's part of your quad. But you are in the right area now. This one runs diagonal, and it's not part of a group. It is the Taylor's muscle. It helps you sit down and sew. It flexes the hip and flexes the knee and medially, laterally rotates.
I don't know, man. I don't feel good about this. I'm gonna be real with you right now. The fact that I'm staring at this and you said it yesterday and I don't know what it is making me feel really, really awful.
No, don't. It starts with an S.
Sartorius?
Yes, Sartorius. My dear, don't feel bad. This is how people learn. And honestly, if I can be really, I'm going to be really blunt. I hope it's okay. When you say that you're stupid, it makes you kind of shut down, and you're not. You're not. You're just learning a muscle. And what is Sartorius? The word is meaningless. These things are hard to learn. This is like learning people's names and stuff. We all have these sticking spots. Like for me, it's names, believe it or not. I actually had to study your guys' names for months so that I would know them. I'm just really bad with names. Anyway, so don't feel bad. That was good. Sartorius. So say it one more time. What muscle is that?
Sartorius.
Thank you, ma'am. Yeah! Yes, Miss Stanley.
So, Tori, how I actually ironically remembered that specific muscle. Every time I see it, I actually think of you because it says Tori in it. Sartorius.
Oh! So it inserts into Miss Cooper inserts into Miss Monreal.
Yes, Tori
Yes.
inserts into Miss
I don't
Monreal.
read it. I know that's weird. But I just meant the point is, it goes into pes anserinus, and it's a Sartorius. Tori, I love it.
You said something so cute and then you ruined it.
I know. It was one of those things when it came out of my mouth, it just didn't.
But I won't forget it now.
Yeah, you'll never forget it, because now the horror of my statement will stick in your mind. Thank you, Miss Stanley.
That's an image.
All right. Okay. All right, everybody. Let's go through this again. You have seen this stuff before. We have new stuff to cover too. And we're going to switch our order. Yesterday we started with Miss Yanez. We will not start with Miss Yanez. We're going to start with Miss Bilotic. Miss Bilotic, what is the muscle on the lateral side of this foot? There's actually three muscles, but they're only talking about one right now, that this guy is pointing to, and that my cursor is going over right here. What is this muscle?
The flexor digiti.
Excellent. Yeah, I think you're wrong, but you're wrong for all the right reasons, and I sincerely mean that. No, you're wrong for all the right reasons. It could easily be the flexor digiti minimi. The only thing is that that's the right logic. So pat yourself on the back. I honestly think that logic will get you through the test. I really mean that. But this one, as it goes towards the little toe, do you see how it kind of goes to the outside of the little toe?
Mm-hmm.
So what would happen if this muscle contracted? If it's on the outside of the little toe. You are really close, by the way.
Would it do like an inversion?
Well, that's when your foot moves, but just talk about your toe. What happens if your toe comes out?
Oh, it would. Oh, what's the word?
Yeah, but it's good. So you got it. Good. So what's the word? When things go out to the side, what do we call that?
Abduction.
Yes. So what might this muscle be?
Abductor digiti.
Yeah. And that's what it is. But by the way, again, and Miss Blotnick, this is not me trying to be nice. Again, your first answer was a good one. I could have easily made that answer myself. It was on the bottom of the foot. So the fact that you said flexor, if you would have said extensor, I'd been like, oh my God. But no, the fact that you said flexor digiti minimi was an excellent answer. Okay? Your brain is in the right spot. So pat yourself on the back. Okay. Miss Cooper. Sorry to call you again so early, but we're going in reverse order.
Okay.
Okay, Miss Cooper, there are two muscles here. We can break them down and do them together. What do you suppose this one is called that goes to all these toesies down here?
Flexor.
Yes, it's on the bottom. It's a flexor. You are already nailing it.
I could say the whole thing really fast, but I'm just breaking it down.
Sure.
Digiti. Right? Right?
Close.
Well, how's that wrong?
Well, you're thinking digiti minimi. When it goes to a lot of toes, what do we call it? It starts with digit. Tor?
Is it a digitorum longus?
Yeah, so flexor digitorum, it's probably not long because it's on the foot and it looks kind of short, right?
Yeah.
So flexor digitorum brevis, but the flexor digitorum was the important part. You did great. So that one's flexor digitorum brevis, probably. I say probably because I don't 100% know these. What about this one going to the big toe?
A hallucis?
Yes. Thank you, thank you, thank you. And it's on either the bottom or the side of the foot. So it's got to be one of two things.
Well, it's a flexor.
If it's on the bottom, it's a flexor. If it's going a little bit to the side of the big toe, it might pull out the big toe. And what do we call it when stuff gets pulled out to the side?
An abduction?
Yes! Now, if that's true, what would this muscle be called?
Abductor hallucis longus?
I think just abductor hallucis.
Abductor hallucis?
Let's find out. Can you see the title?
Yeah.
You should be proud of yourself.
Yeah.
That was intelligence, by the way, my dear. You pieced together. Forget about memorizing. Memorizing's not a sign of intelligence. You pieced together facts and you put them together. Good job. Abductor hallucis and flexor digitorum brevis. And even your missed answers were right on target. They were very close. It was the same thing that Miss Blotnick did, so that's fantastic. Thank you, thank you, thank you. Woo! Okay. Miss Felix Osuna, you are up. Miss Felix Osuna, what is this muscle?
Is that the extensor digitorum brevis?
All day long it is. Good job, ma'am. Fantastic. It's on top, it's an extensor, it's going to the digits, it's digitorum, and it's short. Brevis. We'll take it. Boom. Miss Hanson, what's this?
Flexor digitorum, is that brevis?
Yeah, because if you think about it, you're right, by the way. And again, I don't think the test gets really nitpicky about brevises and longuses, but if you think about it, you know like the muscles in the back of the leg, right? What are the three calf muscles?
Gastrocnemius, soleus, and plantaris.
Yes, and then underneath those, there were three other muscles. Do you remember what they are?
You have your, oh gosh.
Yeah, this is not easy. But one of them is the long version of this.
Flexor digitorum longus.
Yes. Flexor hallucis longus. Yeah. Yeah, you're about to say it though. Yes, you're right.
Anterior tibialis.
Well, I like to put the anterior tibialis on the front of the leg since it's called anterior.
Yeah, so posterior.
Tibialis posterior. Good.
Yeah.
Cool. But anyway, that's why this would be brevis. But anyway, you did great. You did great. Miss Harper.
Yes, sir.
What's this, ma'am?
aponeurosis.
Yeah.
Something.
What region? What region of the body is it in?
Plantar region. Plantar aponeurosis.
Beautiful. That's the kind of thinking I want. By the way, guys, I don't think this is on the test, but I just want you to, I want that kind of logic. It's in the plantar region. It's an aponeurosis or fascia or whatever. This is it. That was beautifully done. Thank you, ma'am. Miss Hunter. Miss Hunter, what is this muscle?
Digitorium longus.
Okay. Is that the full name? You have, so far you have described, by the words you have used, you have described a long muscle that goes to multiple toes.
Extensor.
Oh, so what's the full name now?
Extensor digitorium longus.
Okay. Guess what?
Awesome.
Yeah, it is awesome. Very impressed with you. Thank you, ma'am. Miss Monreal, I'm sorry, you had your hand up for a while. Miss Monreal, I'm singing to you. Why is your hand
Did you
up?
just call on me?
No, I just want to know why your hand's up.
Can you?
I can kind of hear you. You are cutting out, but I called on you because your hand is up.
Hello?
Okay. Never mind. I haven't called it
Well,
yet.
because I want to ask you something.
That's why I'm asking you. Why is your
Yes.
hand? All right, what's your
Okay.
question, ma'am?
Well, can you hear me now?
I can hear you now.
Here, my question is, on the test, are we going to have pictures that look, okay, on test, are we going to have pictures that look like this, or is it going to be more like drawings?
No, I think it's actually, I think these are the pictures. You follow me?
Okay.
I think these are the actual pictures. Yeah. So this should look very familiar to you. Does that make sense?
Yeah.
Good. Good, good, good. Okay. That's a good question. Yeah, everybody, I believe these are the, like, I am trying to prepare you without giving you answers, but try to prepare you for the actual thing that you're going to see so that you know. So anyway, yeah, these are the actual pictures the test uses.
Yeah, because I really want to pay attention to some of those. Okay.
And that's why, by the way, that's why I'm taping this lecture again, too. So if you want to go back and just look at the pictures and listen to the thing, you could. Yeah. But very good point. Mr. Kandaris, sir, can you tell me what this is? You there, sir? Mr. Kandaris? Miss Cooper?
I feel bad for him. He probably puked and fell asleep.
He probably did, poor guy. Anyway, we'll come back.
Just remind me.
Miss Monreal, you're up. Sorry, but you're back up, Miss Monreal. What is this picture we're looking at?
Extensor hallucis longus?
Yeah, that'd be my guess. It goes up the leg, extensor hallucis longus. And guess what? You're right. Cool, cool. Yeah, it is very cool. Miss Moore. Miss Moore.
Yes.
What is this muscle, ma'am?
Is that the tippy? No, wait, I don't know.
Go with it.
Tibialis.
It is the tibialis anterior.
Okay.
What lets all of us know it's the tibialis anterior? Because it does something unusual.
It wraps around the foot.
Thank you. It goes, great memory. You nailed it. The tibialis anterior, like the sartorius, goes diagonal. And that's a big tip-off that it's an unusual muscle. Thank you. Thank you, ma'am. Cool, cool, cool. All right, Miss Nguyen.
Yeah.
Mr. Yen, what is this muscle?
Gastrocnemius.
Yes, gastrocnemius. Thank you, ma'am. Miss Petrie, what's this muscle?
The soleus.
Yes, ma'am, it is one of the 3 calf muscles, the heart and soleus, the second heart. It is the soleus. It lies underneath the gastrocnemius. It only does one thing all day long. What is the one action it does all day long? Did you just cuss, Miss Petrie?
Yeah. Is it plantar flex?
Plantar flexion all day long. That's all it does. Beautiful. It crosses over the ankle. It pulls it down, and you can do a plantar flexion. Beautifully said. You're doing great. Okay. Miss Monreal.
I just remember this was a question on one of the tests, and I don't remember which one it was specifically saying, but what is the synergist then to the gastrocnemius? Is it
Soleus.
was it rectus femoris? Not rectus femoris.
Soleus.
Huh?
Soleus.
No, but like, was there one? I probably got it wrong. Never mind.
When they're saying, if you guys have a question where they ask about synergists, they mean muscles that are helpers along with that. Don't worry about which one's working more or whatever. Just grab another muscle that does the same action, and that would definitely be soleus.
Does the gastrocnemius help flex the knee though? Does it cross over?
Sure, it does. So if hamstrings were on there and soleus wasn't available, you could argue that, but it'd be an unusual question for them to ask.
Okay.
Yeah.
All right.
But you're right. You have to pick a muscle. You'd have to pick a muscle that has the same action or actions as the gastrocnemius. Yeah. Soleus would be my guess, though. Okay, where was Miss Stanley? Right? Yes, Miss Stanley. Miss Stanley, what is that muscle? Don't make that face. Just tell me.
It is really hard to see that.
Well, there's not much to see. It's about the size of my thumb.
It's not the plantaris, is it?
No, it's the rectus abdominis. I think it's actually a suboccipital. Could be the biceps brachii. But it's definitely not the plantaris. There's no way that a muscle down by the calves that's this size is the plantaris. Never in a million years. It's gotta be maybe iliopsoas, maybe the suboccipitals, maybe the
We're not
longus.
moving, sir.
You know what it is. Tell me what it is. You knew when you first looked at it.
I think dyeing my hair blonde really made me blonde because.
I don't think so. I think you actually knew this answer the minute you looked at it. So what is it? It's the plantaris.
Okay, see, I said that, and you just said a bunch of willy-nilly stupid stuff.
I know, because it's the plantaris. And you knew it was the plantaris.
Yes,
Don't be
but
talking
like
out of
you
it.
made me second guess it, and then it don't do that.
All right, let's try one more time. What's this muscle?
Oh my god, serratus anterior.
Okay, plantaris. Okay, what's this muscle?
No, that one, that's multifida.
Nope, plantaris.
Yeah.
What's this muscle? You know your muscles, ma'am. All right, Miss Torres. Look at that guy. He's so cute, little plantaris. Oh my God, so cute. He's got a long little tail. Miss Torres. Are you there? Good. Miss Torres.
Yes.
What are these two muscles?
Is it the peroneal brevis and longus?
Yes. What's another name for the peroneals longus and brevis?
Fibularis?
Yes. Good job. Peroneus longus and brevis fibularis. That's great. Thank you, ma'am. Mr. Kondaris, are you there, sir? Okay. Just worth a try. Ms. Yanez, What is this muscle?
The rectus femoris.
Rectus femoris, yes. And why did you not think it was the vastus intermedius?
Because it went over the knee and the hip.
Yeah, it goes up in the hip. That's the big part. Cool. Thank you. Thank you. Thank you. Miss Cooper.
Yes. I'm trying to take pictures of these to study, but you're going so fast.
Well, by the way, I taped yesterday's presentation. I'm taping today as I'm going to tape
I
tomorrow.
know, I don't want to watch the whole thing again.
I got you. What is this muscle, ma'am?
Sartorius?
Yes, it is.
Sartorius.
Do you know, that's right. Do you know, and you even know probably the origin and insertion of this muscle now?
Pezzettaritis? That's where it occurs?
It goes down into the leg, yep. And it starts out on the top front bump on your hip.
The iliac something?
Anterior superior iliac spine. Yeah, good job. As is. Good job. Thank you, ma'am. Miss Bilotic. Miss Bilotic. Boop, boop.
Yes.
Hi. Miss Bilotic, what muscle is this? What muscle?
Vastus lateralis.
Right, you are in the right muscle group.
Oh, no, I had this yesterday.
Yeah. I don't know if you had it yesterday, but somebody did. But you are in the right muscle group.
The vastus intermedius.
Yes, vastus intermedius. It's not long enough to be the rectus femoris. It's not really on the it's not on the lateral or the medial side. It's the vastus intermedius. Great job. Thank you very much.
Because the lateral one's like more like, like that.
Yeah. Miss Felix Osuna. Yeah, like that. Miss Felix Osuna. Oh yes. Hold on one second, Miss Felix Osuna. Yes, Miss Monreal.
I don't have my hand up on my end, so I don't.
Well, we all see your hand on our end.
Well, okay, sorry about that, but I do have a question. Now, that's so weird. My hand just popped up. I didn't. Anyway. I know you love me.
Oh, so much.
Okay, so rectus femoris and bicep femoris, I always get so confused with which one's in back, which one's in front. So rectus, would that be like kind of the same as rectus abdominis? It's going to be in the front? Okay.
Well, yeah, I mean, that's not what, rectus means up and down. It just runs up and down. And the rectus femoris, if you think about it, runs straight up and down, and the rectus abdominis does too. They are both in front. That's how I remember. And they're both part of the front fascial line.
Okay.
Like the rectus abdominis goes into the rectus femoris. So that's kind of how I remember.
Okay. I'm going to turn my mic off and know that I'm not putting my hand up right now. Okay? Just in case it goes.
How will I know that? What if you have a question? How do I know when it's a real question?
Then I'll just be rude and turn my mic back on and ask without putting my hand up. I can see your hand up, or who just...
Yeah, I'm waiting for you to call on me.
Michael, what would you like to say? Okay.
I think he's waiting for you to sing.
Oh,
Yeah.
Mr.
No, I was just kidding.
Tapscott, Mr. Tapscott.
All right, thank you, ma'am. No, I didn't have a question. I got you. Okay. But if you have a question, just raise your hand. We're good. We're all good.
Okay.
Okay, where was... Oh, Miss Felix Osuna. Miss Felix Osuna, what muscle is this?
That's the vastus lateralis.
Yeah, it's huge. It is what gives the shape to the side of your thighs, guys. When you're standing sideways looking all cute for your selfies and stuff, if you're getting your leg, you hope that muscle gives that nice soft curve to your thigh. That's what it's known for. Very good. Thank you. Where was I? Miss Hanson. Let's see if we have a very hard muscle for you. What is this teardrop muscle that he's kind of pointing to the top of here?
Vastus medialis. Am I saying it right?
You're saying it right. Yeah, you're saying it perfectly right.
Okay.
I just love it when you try to say muscles.
That's so crazy.
Yeah, it is. I often wonder like how Miss Nguyen or Miss Harper do it, because I'm like, you're translating from your language into English and then back into Latin, and I'm like, I can't even do one of those translations.
I can't do it. It's,
Yeah.
Yeah, I mean, it's not English, but it's
No.
just, I can see it in my head, but it doesn't come out when it works.
No, it doesn't. It really is tongue tying. Anyway, you got it right. That's the point. Miss Hunter, what muscle group is this?
This is the hamstrings.
This is the hamstrings. Thank you. What are the names of the hamstrings, ma'am?
Semitendinosus, semimembranosus, and biceps mors.
Yeah. Very cool. What are the names of the hamstrings from lateral to medial?
Lateral. Lateral is the tendinosus. Most lateral, right? Okay, so most lateral one is the bicep femoris, and then it's tendinosus, and then it's membranosus.
Thank you, ma'am. Good job. You did good. Mr. Kandaris, sir. Okay. I think you're down and out, buddy. For the count. Let's see. Miss Monreal, what muscle is this? You don't have to raise your hand, you can just answer. Miss Monreal, what muscle is this?
Gluteus maximus.
Yes, ma'am. Gluteus maximus. Thank you, thank you, thank you. Miss Moore, what muscle is this?
The minimus, gluteus minimus,
Gluteus medius, because it's on the side. Max, med, min. Gluteus medius. Good job. Thank you, ma'am. Miss Nguyen, what muscle is this?
I think the gluteal medius.
Gluteus
I don't know that.
minimus. Yeah, gluteus minimus. Good job. Thank you, ma'am. Miss Petrie, what muscle is this?
The TFL, tensor fascial latte.
Tensor fascia latte. I'll have a tensor fascia latte, please. With extra whip. Okay, cool. Thank you. Miss Stanley, what muscle is this? Don't you dare say plantaris.
It's plantaris.
Yeah, you're pretty close.
Okay, fine. It is.
What?
It is the
Yeah, I'm actually not sure. I always get confused on this one too. What muscle group are we dealing with?
It's the. I get the AV and AD mixed up, but it's the and adductor something. And brevis.
Adductor brevis? Yeah. It's an adductor because it's between your legs and it adds them back together. Adductor brevis. Good job. Cool. Thank you, ma'am. Ms. Torres, what's this? What's the really red muscle in here?
Adductor longus.
Yes, ma'am. Good job. Adductor longus. Ms. Yanez, what is this red muscle here? They're showing several muscles, but what is the red muscle? This person is laying sideline. You are looking at the medial thigh, and there's a red muscle that is fairly posterior on the medial thigh. Not often that we stump you, Miss Yanez. That's good. You're still getting challenged in class. I love this. Okay. What muscle group are we looking at?
The adductor.
Good. So we know it's one of the 5 adductors, right? Cool. Do you know something about the adductor that lives most posterior to the other adductors? Because the other ones are built up on it like a shelf. I might have mentioned this before. Some people say that this one almost acts like a hamstring. It's so posterior. It's still in the middle thigh, but it's behind the other ones that you can see more up front there. And this one's really big.
Is it the longest? Vagus?
That's longus. That's brevis, longus. That's Magnus. You're right, Magnus. Magnus, everybody. is, I know this is hard to visualize, but remember the thighs are big around. There's 5 muscles, just like my hand. There's 5 muscles in the inner thigh, right? Look at my hand here. This back here might be the magnus. It's back, it's still in the inner thigh, but it's further back than the other ones. The other ones stack on top. They actually lay on top of the magnus. That's what they do. So when you're rubbing the back of somebody's leg and you kind of go a little medial at all, you're hitting the magnus. When you flip them over and you kind of go a little medial at all, you're hitting all the other adductors. So anyway, adductor magnus. Cool. Thank you, ma'am. It's good. I just realized, what if it wasn't magnus after I said all that? But it was. Good. All right. Miss Bilotic.
Gracilis.
Why do you say that's gracilis?
Because the sartorius is the one that curves, and then the gracilis is the straight one.
And it crosses the knee. I like your logic. You are exactly right, Miss Bilotic. Very excited about this test. Good. Gracilis. Strangely, the longest adductor is gracilis, not the longest. Yeah. Okay. And Miss Cooper, what is this last of the 5 hip adductors? We've covered the other ones.
I don't think anyone said it, 'cause I've been here.
Yeah.
So it is. I'm trying to think of the one I already went through, so I can.
Here, I'll help you. Hold on. We went through, what's this one?
Adductor brevis, adductor longus, and then adductor magnus.
So we did all the adductor ones, and then we did,
gracilis. So pectineus.
bam! Good job, ma'am. Bam, 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 bam. So pectineus is really small. Awesome. Thank you, ma'am. That was good. Good stuff. Miss Felix Osuna. By the way, everybody, here's another good picture of how the adductors stack up on top of each other. The magnus is back here. The other ones are more anterior. But anyway, Miss Felix Osuna, what is this muscle?
That's the TFL.
Yes. And what is this line of fascia here that goes all the way down the side of the leg?
The IT band.
Yes, iliotibial band. Beautiful job. Or iliotibial tract. Both are equally valid. Cool. Thank you. What's this muscle again, Miss Felix Osuna?
That's still the TFL.
There's tensor fasciolata. Thank you, ma'am. Miss, good job, by the way. Good job. Miss Hanson. Miss Hanson. Actually, Miss Hanson, can you hold that thought? Do you mind?
Yeah.
Thank you so much. I think you know where I'm headed with this. Miss Cooper.
Hello.
Hello, Miss Cuba. Miss Cuba.
Oh my God, is that the same one, but on a different part?
I don't know. There's only one way to find out. You got to take a risk, and you got to name it, and we'll find out.
But it's not a risk. It's the sartorius.
Goes diagonal across the leg. This is the pes anserinus area down in here. That's the as is anterior superior iliac spine. You can actually see the bump right up there.
Yeah.
Well done. Thank you, Miss Cooper.
Thank you.
Thank you. Thank you. All right, Miss Hanson. Thank you, Miss Hanson. Miss Hanson, what's this muscle?
That's the gluteus maximus.
It is. Absolutely. Kind of inserts into the IT band there. Love that. Miss Harper, what is this muscle?
That's the piriformis.
Oh, man, she doesn't even hesitate. Yes, that's piriformis. You're right. There we go. Miss Hunter, what's this muscle?
Quadratus something. I only remember quadratus because it's 4 sides.
Well, you're good. So maybe it's gonna name the location, or so it could be like, I'm just guessing at things like quadratus gluteus, quadratus.
So I want to say, because that's the femur, that it's femoris, but I felt weird saying that.
Oh. Well, don't say that then. If you feel weird saying quadratus femoris, don't say that.
Is it the femoris?
Is it the what? What's the whole answer?
Quadratus femoris. Yay.
Yeah, that's right. Good job. Really good job. I really love what Miss Hunter did there. She wasn't sure, but she went off some stuff she knew. Four-sided muscle, quadratus, and then femoris sounded pretty good. That is the exact logic you'd use on a multiple choice test, right? You're not always just thinking of the answer, you're eliminating other stuff. And I hate to tell you, if we ask you this question on the test, I guarantee quadratus lumborum will be one of the answers, right? Because we want you to figure out four-sided muscle and not in the lumbar area, femoral area. So it would have those kind of answers. That it will do, because it wants to make sure you understand how this stuff is named. Okay, Mr. Kandaris.
Yes.
Oh, okay, sir. We lost you for a while there, sir. What is this item in the body? It's not a muscle.
Yeah, it looks like a muscle.
Yeah? The red thing?
Mm-hmm.
Okay. Well, maybe it is. I could be wrong. What is it, sir?
I don't know. Looks interesting.
It is interesting. It's a very interesting muscle. So is that the belly of the muscle or the tendon?
Maybe the tendon and the QL.
Yeah. Maybe. Yeah. I mean, by the way, I'm still not sure about this whole is a muscle theory thing you've got going on, but. Any other ideas what this might be, sir? It's sneaking out underneath the piriformis, which I think is very interesting. It's almost as though the piriformis could pinch this item.
Is that a deep 6?
Well, the piriformis is a deep 6, and it can pinch this thing coming through it.
Mm-hmm.
It's why we care about the piriformis, because it can pinch something.
Oh, is that the sciatic nerve?
Or the sciatic muscle, but I don't think there's a sciatic muscle. So let's go with sciatic nerve. You are correct, sir. Thank you. All right. Yes, Miss Petrie. Here it comes.
I got asked if we can have a 15-minute break.
Oh, you got asked if you can have a 15-minute
I
break.
did.
Well, were you asked by somebody that we? Was it Miss Nguyen that asked? So your camera comes on when you want something, Miss Nguyen. Is that when you use your smile? You just smile at me. You just think you can flirt your way into a 15-minute break?
She's busting out all the charm now.
Actually, Mr. Nguyen.
I have something, but I need to do.
No, I understand. If it was Miss Moan Real asking, I would give us like a 3-minute break. But for you, Miss Nguyen, not even 15 minutes, 16 minutes. We are going to take a 6.
Is that iliacus?
It is iliacus. It's in the iliac fossa. It inserts into the lesser trochanter of the femur. It is the iliacus all day long. Yep. Thank you, ma'am. Miss Moore.
Just question.
Sure.
Does the psoas have the same insertion as iliacus?
That's exactly
Okay.
right. The psoas major has the same insertion as the iliacus. Some people don't even have a minor. Anyway, the major has the same insertion, which is why people pair them together. We think they work together. We think they have a hard time not working together. So I say iliacus, you say psoas major. I say psoas major, you say iliacus. They definitely go together. Iliopsoas.
Okay.
Yeah. Well said. Thank you, ma'am. Miss Moore.
I had that one yesterday.
Oh, well, good. You'll get it right.
One.
Well, tell me this one, and I'll give you another one.
Oh no, when I do this one, I don't want that one. So this is gonna be the iliacus, right?
Well, how about this one be the iliacus?
Okay, that's gonna be the iliac, right, is that right? Iliac crest, something like
Well,
that.
iliac crest is part of a bone. What muscle is this?
The muscle is, I forgot.
I told you it starts with a P, but that doesn't help.
Oh, psoas.
Psoas major. Psoas major is what that is. Good job.
Yeah, you did tell me that yesterday.
Got it. Cool. Thank you, ma'am.
Okay, bye.
Bye. Miss Nguyen. Miss Nguyen. What muscle is this, Miss Nguyen?
I think in the in the long I don't know how in the good muscle in the spinal longer and cord. I don't know how to talk.
No, that's pretty good. Ilio. Co. Stal. Yes. Yeah, iliocostalis.
I remember about in the good muscle about the pinnacle and the longer intimal and yeah, I don't know how to talk about iliocordinalis. Okay.
That was good. You're doing great. I'm really impressed with your retention. It's excellent. All right. Miss Petrie, what muscle is this?
The longissimus.
The longissimus. Good job, Miss Petrie. Miss Stanley. Miss Stanley, what muscle is this?
This is spinalis.
Yes, she's right. It's half of the spinalis on both sides. Boom. Nicely done. Thank you. Miss Torres.
Yes.
What two muscles are these?
Multifidus and rotatories. What?
Rotatories? Unless you're kind of like, you're kind of a redneck, then the rotators. The rotatores.
What?
Yeah.
Say it again. Not like that. The right way.
Rotatores. Rotatories.
Rotatories.
Yeah.
Has your last name, kind of.
What?
What?
Has your
my
last
name?
name in it.
I got to be. What'd you say, Miss Cooper?
I said it kind of has your last name in it.
Oh, yeah. Rotatores.
Yeah.
I like that. Rotatores. Very good point. So which ones are on top and which ones cover the sacrum?
The multifidus
Good. That's what I want to hear.
are in the top because they go all the way to the sacrum.
And they're longer, yeah. Good job. Thank you, ma'am. Good stuff. You're doing good. Miss Yanez.
Yes.
Here's a trickier one.
It's either splenius capitis.
I'd stop right there.
Okay.
I love what she said. Splenius capitis goes from the spine to the head. Splenius capitis. I know the other one you were going to guess, but I didn't want you to say it out loud because I want this stuck in your head because you're right. Splenius capitis kind of goes out there and hooks to your cap. Yeah, good job. Thank you, ma'am. Miss Baladik. Miss Baladik?
Hello.
Oh, hi, Miss
Sorry.
Baladik. That's okay. Miss Baladik, what muscle is this? It creates the speed bumps of your neck. And it goes to your head. And we don't talk about it that often, so it's going to be hard.
I don't know.
Yeah. It goes over part of the spine and goes to your head. Kind of part of the spine goes to your head. What would be a good thing to call it if it goes to your head? Let's look at the last muscle and see what they did. This muscle goes from the spine to the head, and it's called...
The splenius capitis?
Yeah. So this one goes from part of the spine to the head.
Does it have capitis in it?
I think it does.
Okay.
Something capitis.
Semi-spinalis capitis? Woo!
Good job, man. Semi-spinalis capitis. I like your thinking. That was really good. Thank you. Miss Cooper.
Hi.
Hi, Miss Cooper. What muscle is this?
What's up?
What's up? We actually already had this one
Yeah, the spletus capitis,
Good
right?
job.
Yeah.
Yes, Miss Cooper. Thank you for paying attention. You did really good. Thank you. That's good. Splenius capitis, beautiful. Miss Felix Osuna, what muscle group is this?
Are those the suboccipital?
Yeah. Two finger muscles back here, suboccipitals, yeah. Most massage therapists don't know all their names. By most massage therapists, I think I'm including me. You've got like, what is it? You know, oblique capitis, superior and inferior and all that kind of stuff, and rectus capitis, whatever, but major and minor and things like that. But anyway, most therapists refer to them as the suboccipitals. Good job. Does anybody know the name of all these, all four? Because I don't off the top of my head. Okay. Well, you're not going to hear it from me. Okay. All right. Miss Hanson. One guess. What is this muscle?
Trapezius.
Trapezius. Good. What are the insertions? Trapezius essentially has an origin off the back of your head and your spine. What are the insertions of the trapezius?
The occiput? Is that?
No, I mean, that's kind of where it starts. Where does it go?
Oh, it's here.
Yes.
Shoulders.
Yeah, good. So it has 3 insertion points. They're all connected together. Do you remember what they are? Yeah.
Can I say them? It's like.
What's that thing back there?
The spine of your scapula.
100% correct. And then the spine of your scapula turns into your what?
Acromion process.
100% correct. And if you keep going over there, you get to the lateral 1/3 of the...
It's not clavicle, is it?
Yeah, it is clavicle.
Oh,
So, spine of the scapula, acromion process, lateral 1/3 of the clavicle. That's the insertion for the trapezius. What is the origin for the deltoid?
The deltoid tuberosity.
That is the insertion. Where does it start?
The acromion process.
Mm-hmm.
And the 1/3. I mean, it's all in there, right? So it's the. Oh gosh, it's the same.
Good. I forgot what the same is though. I'm kind of at my age. The spine of the scapula. Which turns into the
acromion process, which turns into the clavicle.
lateral 1/3 of the clavicle.
Lateral 1/3.
So the insertion of the trapezius is the origin of the deltoid. Thank you, ma'am. Good job. That was a lot. Okay. Miss Harper.
Yes, sir.
I don't know if this is a fair question. I'm assuming, well, what do you assume this is?
This director Spinay group.
That's what I'm going with. Plus, they're also, by the way, showing some of the QL down there, so it's kind of confusing.
Yes.
But anyway, yeah, Rector Spinay group. All right, what is this, ma'am?
That's the QL, quadratus lumborum.
Thank you very much. What's the nickname for the quadratus lumborum?
Is that the hip hikers?
Yeah! Hikes up your hips so you can walk around. Yeah, it is also the deepest abdominal muscle. Good job. Thank you, thank you, thank you. Miss Hunter.
Are you calling me?
I am calling you, Miss Hunter. Miss Hunter. What muscle is this?
It looks like serratus. No. That is in the abdominals. It looks like an oblique. It could be internal oblique. That's not right?
Well, what's the rule of thumb that Tapscott's been using all year? This is for everybody. What are these?
I thought those were internal. And then that's external.
But my arms are internal right now. That's how we remember. They're inside themselves. This is internal. This is external.
Oh, I didn't know that. Okay. So this is external.
External obliques, yeah. By the way, though, I'm quite happy with your answer for a couple reasons. I was even happy with serratus anterior because that's the direction the fibers of serratus anterior run, but serratus anterior is up much higher, and you caught that right away. And then you caught on that it was an oblique because you saw diagonal abdominal muscles, so that was excellent too. We just had to iron out the external and internal. But just remember, guys,
No, I just saw that it was in the stomach, and the serratus is not that in the stomach, so that's why I thought it was abdominal.
You're ruining this moment for me. But by the way, guys, I'm sure there will be questions on the test about the rotation created by abdominals, external and internal obliques. So if you don't remember, if you can't do this thing with your hand, you're going to be in big trouble on that question. Anyway, that was good. External obliques. Yes, thank you, Ms. Hunter. Mr. Kandaris, sir. Mr. Kandaris, where did you go? Okay. Miss Monreal, what muscle is this?
Oh gosh, I hate the abdominal muscles. Hang on. So, I don't know. I'm gonna guess, but it's not transverse, is it? Can you hear me?
Oh, I can hear you. I was just so dissatisfied with your guess. I didn't want to actually acknowledge it.
Okay, well wait a minute. Okay, so hang on.
Are the fibers running in a transverse direction?
Well, okay, hang on though. I guess not. I can't see that well, and I am driving, but...
Hey, that's not my problem, ma'am.
Hold on, let me enlarge this.
That's a good idea. I just picture her getting pulled over one day going down the street.
Yeah, I know. I don't know, man. Okay. No, they're going down, so... Is it external oblique? I don't...
What's the hand rule we use for external oblique that I just went over?
Well, I know you just did it with Miss Hunter, but again, I can't see the screen all the time, and I thought she had internal. I don't know. Let me just act dumb so everybody else could feel smarter.
I love you.
Okay.
External obliques, internal obliques.
Okay. Yeah, I knew you were doing the hand signals. I just couldn't look at it while I was
When my
driving,
arms are wrapped in on themselves.
I still won't forget it.
Internal obliques, external obliques.
Okay, I still won't get it, but I'll practice tonight because I'm going to rewatch these videos.
Good. So what is this one, though?
Is it internal?
Yes, ma'am. It's internal obliques.
Okay.
You are.
Okay. I was totally guessing. I still don't even get it, but okay.
Well, think about it. If that guy took his right hand right now and took it over to his left side, he'd be pointing down those things right now.
Okay.
Yeah. Yes, Miss Hanson, please.
Can you go back to the external slide
Yeah,
really
and
fast?
by the way, I admit it's very hard to see on internal obliques, but here is external. The fibers are actually running down. And here's internal.
Yeah, it's still confusing to me, but I will not give up.
No, you won't. Yeah. Does that help, Miss Hanson? Kind of, sort of, maybe? It's hard to see the fibers, I get it.
Do you want to ask me something
It helps
else?
a little.
Yeah, good. It really does help if you do the hand signals. That's the only way I know how to do it. This is about the angle those external obliques are going, and this is about the angle those internal. And no, Miss Monreal, you're good. We'll come back to you when we get to you. Miss Moore. Miss Moore? Going once, going twice. Miss Moore? Mr. Kondaris? Okay. Miss Nguyen?
Yes.
Miss Nguyen, what muscle is this?
I think the rector abdomen. I don't know how to talk that, but I think rector abdomen.
Rectus abdominis.
Rector abdomen.
Yeah, that was really good. Abdominis.
Please talk again.
Dom.
Me.
Nis.
Yeah. Okay. Abdominis.
Yeah, that was beautiful. Rectus abdominis, you're 100% correct, ma'am. Thank you. Thank you. Miss Petrie, what muscle is this? Think about fiber direction.
Is that the transverse abdominis?
Do the fibers run in a transverse direction?
They look like it.
Yeah, you're right, ma'am. Good job. That is the transverse abdominis. It's cut there and it's kind of weird, but you see how the fibers are going around the body. Yep, good job. Good job. Miss Stanley. Hi. Thanks for waving. What muscle is this?
Would that be this?
I'm sorry, the what?
The scaling?
Uh,
I want to say the Vader scapula, but it's not on the scapula at all, so.
Good, don't say that. Don't the scalenes attach to the transverse processes of the cervical vertebrae and then attach to ribs 1 and 2? And aren't there anterior, middle, and posterior scalenes too? I'm just going to bow my head down in prayer right now and help you.
What? How would that? No.
Oh, I think it's a good time to pray.
Really?
Mm-hmm.
You're gonna be like that?
Yeah.
Why?
Because I just think it's important to use my prayer muscle to bow my head down in prayer so you can help remember the actual official name of the prayer muscle. This is the prayer muscle. That's why I bowed my head down in prayer. What spots is it going to and coming from?
Looks like it's going down to... Oh, Jesus.
Ha! Damn! What is it, ma'am? You know it now. And
I'm mad. Like, I don't even want to say it. I'm so mad about it.
Well, I'd like to get to the next muscle.
Mastoid.
Sternal, cliental mastoid, sternal, cliental mastoid, sternal, cliental mastoid. For everybody, sternal, cliental mastoid. It goes from the sternum, the clavicle, to the mastoid process. Yes, ma'am. I wonder if there'll be a question on the test about all the muscles that attach to the mastoid process. Because there are 4 muscles that attach to the mastoid process. The sternocleidomastoid. Anybody know the other 3? Miss Hanson, so honest. She's like, no, not a clue. Longissimus?
The masseter is one, right?
No, my dear, the masseter's up here.
Yes.
It sounds like it should, but what are you saying, Miss Torres? As you suntan out there? Were you saying something? No? Anyway, longissimus, the splenius capitis gets up there, and the digastric, which is one of your suprahyoid muscles, actually goes back there. Digastric, it's deep there. Just thought I'd throw that out there. But don't write that down in your notes. There's no way that's going to come up. I mean, no way anybody would ask that.
Can you repeat that?
About the 4 muscles that
It's
attach.
the 4 muscles that attach into the sternocleidomastoid?
No.
Is that what you're saying?
4 muscles that attach to the mastoid process of my temporal bone. And the reason I care about that is this is a high pressure area that a lot of fascial lines connect to. So my longissimus comes up from the back and attaches to it. My splenius capitis comes from the back and attaches to it. My sternocleidomastoid attaches to it. And one of my suprahyoid muscles, the digastric, attaches to it. So sternocleidomastoid, good job, Miss Stanley, by the way. I know you're frustrated, but you did catch it. And that's all that matters. And I think if you would have had 4 choices and those were one of them, you would have been like, wow, right? That's the idea, at least.
Yeah, my biggest thing is just like when I see neck muscles, I immediately want to try to like get rid of the harder ones. So the easy ones go right over my head.
Yeah, no, I hear you. Here's a good view of sternocleidomastoid, everybody. Carotid artery there. All right. Miss Torres, come back to us on that hammock of yours.
I'm here.
What muscle do you suppose this is? It's a muscle. It's a muscle Miss Stanley wished she got.
Scaling?
It is a scaling. How many scalings are there?
4?
3. There's a posterior, a middle, and a anterior. Which one do you suppose this is?
I'm gonna say the middle.
Say anterior.
I'm just guessing.
Anterior.
Okay,
Your
anterior.
anterior and your middle scaling attach to the first rib. Your posterior scaling attaches to the second rib. They all come out of the transverse process side of your neck. But anyway, this is your anterior scaling. Good job, though. You knew it was the scaling, and that's really good. Ms. Yanez, what is this?
That's the middle scaling.
That is the middle scaling. It grabs on. The posterior scaling, by the way, everybody grabs onto just like the last 2 transverse processes. It's kind of tiny. And it goes to the second rib. Good guesstimation. Correct. That's good. Miss Bolotic, what is this? Or what muscle group do you think it's in?
The neck muscles?
That's true. I meant a little more specific than that, but I love that answer. It is a neck muscle. Might have been one we've been talking about for a while. Last 5 minutes or so. Were you listening to the last 2 people?
No.
Okay.
I was eating my toast. I'm sorry.
No, it's okay. It's okay, ma'am. Thank you for being so honest. Okay, so let's go back because actually everybody needs to kind of review this stuff. So hold on a second, okay?
Okay.
All right, and just eat your toast, but pay attention. We'll come back to you. All right, Miss Cooper, what muscle is this?
Sternocleidomastoid.
Perfect, thank you. Miss Stanley, what muscle is this?
That is one of the scalings.
Yep, which one, ma'am?
Lateral.
There is no lateral scaling. They are all lateral.
Isn't it like something middle and then? So if there's a middle, isn't there medial and lateral?
If there's a middle, it just means it's between the other 2.
So then it's posterior or anterior?
Yeah.
Oh, then that one's like anterior.
Okay, there we go. Thank you, ma'am. Cool. So, Miss Bolotic, what would you guess this muscle might be?
I think I remember middle scaling.
Yes, there you go. It's the middle scaling. Good job. So there are 3 scalings. There's the anterior one. Here's the middle one. Good job. Miss Moore, are you there?
I'm here.
Oh, nice you to join us. Okay.
Wait, I wasn't here.
What is this muscle, ma'am?
Is that like a scaling?
It is a scaling. Which one?
Anterior.
Anterior would be a good guess. That's anterior scaling.
Middle.
That's a great guess. Thank you, ma'am. Middle scaling, awesome.
I
Thank
was
you.
not a guess. I worked hard to get your answer.
I meant like educated guess. I didn't mean it as an insult. Thank you. Yes, Miss Cooper.
Could you say the last two one more time?
The middle scaling
Okay.
and the anterior scaling.
Okay.
Anterior scaling, middle scaling. What do you suppose this one is, Miss Cooper?
Anterior, middle, and lateral?
If there's an anterior, there must be a
Posterior scaling.
Thank you, ma'am. Posterior scaling. Good job. Cool, cool, cool. Okay. Mr. Kandaris. Okay. Miss Yanez, what is this muscle?
Is that the masseter?
Yeah. And so you can see how it hooks to the zygomatic arch and the skull. And just to let you know, I know you know this, I'm not trying to, but the mastoid process is all the way back here behind the ear. But anyway, that's the masseter. It's a two-bellied muscle, actually. And it's really powerful. Your main chewing muscle. Thank you. Okay. Now I'm all mixed up where we were, but thank you, Ms. Yanez. Ms. Torres, what's this muscle?
That's the temporalis.
Yeah, she's right, everybody. It's temporalis. It actually goes underneath your zygomatic arch. It's the reason you can't put your fingers in here under these bones, but we can on the skeleton, and hooks into your jaw. It is a chewing muscle. Temporalis.
Why you ask me? Just because I'm an SD doesn't mean I know. I'm just kidding.
Yeah, that was not why. I just started going back up the alphabet. But anyway, but you should know, by the way, I forgot about that. You should know that that's temporalis. Yeah, and it also hooks into the Gallia aponeurotica up here, all the aponeuroses up here. So it's a good muscle to work. Okay, Miss Stanley. Oh, Miss Stanley. What a hard question to give you. I'm so excited. What is this muscle? What muscle group is this muscle in? How about that?
I might need help with remembering, but I know I recognize it because it's the one that kind of has this pulley thing that reminds me of a zip.
Yeah. So wait, we've got, what muscle group is it part of?
I don't know any fancy words, but it's like a jaw group.
It's a group of muscles above the hyoid bone.
Like in here.
It's a group of muscles above the hyoid bone. What would we call something that's above?
Oh, okay. You're gonna be like that. Okay. Suprahyoid.
How many suprahyoids are there? Why would I do this with my chin?
Hey, I was gonna say 4. Why'd you give it to me?
And how many infrahyoids are there?
4.
Yes. So this is a suprahyoid, although it didn't really get the name of a suprahyoid because it doesn't actually touch the hyoid bone, because as you pointed out correctly, it goes through a sling on the hyoid bone. So it's one of the few muscles that does not have the word hyoid in it, but it pretty much is a suprahyoid. It's a two-bellied muscle that attaches to your mastoid process from your jaw.
So it's, if it's two-bellied, does it have bi in it?
Darn close. But unfortunately, some people
Is it di?
Yes.
Di. So, di.
And then we need a word for belly. Or digestion, kind of like that.
Diceps?
I like that, diceps. That's good.
Well, diceps is head. Never mind.
Yeah, we need something kind of digestion, kind of gastric-y, you know.
Digastric.
That's it. It's digastric, and I don't normally put hyoids in, but this was in here because of the fact that this also attaches to the mastoid process. Gosh, I keep saying mastoid process a lot. Huh. I wonder if I'm obsessed with that. I wonder if I would test people on that. No, I probably wouldn't. Don't worry about it. All right, everybody. Miss Cooper, you have your hand raised?
No, I don't.
Okay. No, you don't. Okay. And this is just showing you the group of the suprahyoids, everybody. This is multiple ones. This is the digastric, the mylohyoid, the stylohyoid is in here. These are all the suprahyoids above the hyoid bone, right? Ms. Petrie, what muscle group is this? It's a group.
Would that be the infrahyoid?
Let's see. Kind of fits in this space. I think it's a pretty good guess. She's right. That's the infrahyoids. And you guys can see a really weird one heading off over there to the superior angle of the scapula, by the way. That's the omohyoid. But anyway, yeah, you were right. Those are the infrahyoids. Good job. Good job. Miss Nguyen, what is this muscle?
Beautiful deltoid.
Beautiful deltoid. I love that. Yes. And Miss Hanson, you now know what are the origins and insertions for the deltoid. And thank you for laughing.
The deltoid tuberosity,
That's the insertion, yes. That's down here.
the lateral 1/3 of the clavicle,
Yep.
the acromion process, and the spine of the scapula.
Beautifully done. Thank you both. Thank you both. That was really good. Miss Moore.
Yes.
What muscle is this? It's only half of it, but what muscle is it?
Trapezius.
Yes, ma'am. It's trapezius. Thank you so much. Ma'am, this trapezius inserts into the same origins as the deltoid. Where does it insert over here? What do you call all this? Miss
The scapula.
Yeah. What are the spine of the scapula?
The
Turns into the what process?
acromion process.
Yep. And then goes into the
Lateral border of the clavicle.
lateral 1/3.
1/3.
That was good. That was good, ma'am. Thank you. We'll take it.
Okay.
Thank you. Thank you. Miss Monreal.
Yes.
What is the muscle here in red? They're showing you several muscles, but the one in red.
Okay, hang on. I gotta enlarge the.
Oh my gosh. Allergic to all this.
Okay, I'm gonna pull over. Just give me 2 seconds, because I can't see. Hang on.
Oh, Miss Monreal.
Okay. Oh, okay. I had to figure out what body part that is. That's latissimus dorsi.
Thank God, yes. It's a large lateral back muscle, latissimus dorsi. Well done. Thank you, ma'am. Thank you, thank you, thank you. What are the main actions of latissimus dorsi?
Me?
Oh, yeah. You, Miss Monreal, of course.
Oh gosh. Like I know it hooks onto the arm. Okay. It adducts the arm, elevates.
It elevates?
Not elevates, but brings it back. So that is, hold on, the first motion you did was adduction.
She's right, by the way, everybody. She did perfect. It adducts the arm, and then I also did this.
Is that the shoulder? No. So what is the second movement?
I don't know. You tell me.
Is it different adduction? Like, is there another word in front of it, or flexes? Stop.
So, ma'am, you got adduction. I came back to my body.
Okay.
Right? What happens when my arm moves back like this? What do we call this?
Is that a flexion?
You want to call it that? So things heading towards the backside of my body are flexions now?
Oh, it's heading, but it's coming to the front of you.
Is it coming to the front? I thought it was heading back.
Oh, okay, okay. I mean, yeah, I guess.
Remember,
that's
out here, this is nothing. This
Okay.
is something and this is something. The minute I start going back, what is this?
Okay, so an extension then?
Thank you. It is a powerful adductor and extensor of the glenohumeral joint. That is correct.
Okay.
Because it reaches up from underneath my arm, by the way, and grabs like this from behind me, it actually also can create medial rotations. But that was
Okay,
good.
so in describing the movement, it would be an adduction of the glenohumeral joint. See, I was thinking the arm anyway, so I would have been wrong. It's
Well, the arm moves.
Okay. All right, thanks for nothing. No, I'm just kidding.
Thank you, ma'am. I'm sorry, guys. The reason I'm giving you less answers is I won't be there to answer your questions when you take the test. So it's kind of time to do or die now. Okay. Mr. Kandaris. It's always worth a try. I think you've got to miss the last 2 hours of class, but all right. All right, that's it for you. Hold on, everybody. Okay. Miss Hunter, what muscle is this?
Teres major.
I am so damn happy with that answer. Teres major.
Yes.
Did you just guess, or how did you know it was Teres major?
So I thought it was major because it's large, and I figured major would be large.
Yeah.
And I know minor is usually smaller.
Yeah.
And that it's under, like it's lower.
No,
That's
it's
the
on.
only thing I think.
Well, major's lower. Minor's on top.
Oh God! See, I messed up. All right.
Major attaches to the lateral border of the scapula down by the inferior angle, so it's the lower one. The minor likes to ride on the shoulders of the major.
Oh, so it's on top of the major. Okay.
Anyway,
Cool.
Anytime you say Teres major, you also say
Latissimus dorsi.
yes. Thank you, ma'am. Well
Yay.
done. Good job. Good. Good educated guessing. I actually want that. That's good. Miss Harper,
Yes, sir.
what are these two muscles?
That's there's major and minor.
Which one's on top?
The minor.
She's right. Thank you.
Thank you.
Good stuff. Wait, hold on, everybody. Miss Nguyen is actually calling me. Miss Nguyen, where'd you go? You sat on your laptop? Oh, your laptop shut down. Okay. All right. Well, it's okay. We'll get back on. We'll talk to you soon. I thought she said she sat on her laptop, but I think it just shut down. Okay. Let's see. That was Miss Harper, which leads us to Miss Hanson. Miss Hanson, what is this muscle?
Is that the infraspinatus?
Why do you think it's infraspinatus?
Well, I think it's on top, so I'm thinking it's the infraspinatus, not the subscapularis.
Oh, yeah, you're absolutely right. Subscapularis would actually literally be under the scapula.
Underneath, yeah.
And this thing is right below the spine of the scapula, which is what infraspinatus means. Yeah, you're right. I just want to kind of hear your logic. Yeah, infraspinatus. Good job. Infraspinatus is part of what muscle group?
The shoulder.
Yeah, the rotator cuff muscle
The
group.
rotator cuff, yes.
Hey, what are the four rotator cuff muscles?
The supraspinatus, infraspinatus, subscapularis, and teres minor.
Yeah, but I don't like the way you said it.
I know. I said it weird. Because infraspinatus and teres minor should always go together.
Thank you. Thank you. Thank you. I really appreciate it. Okay. Let's see, Miss Felix Osuna, what's the muscle in red?
Is that the supraspinatus?
Is it above the spine of the scapula?
Oh no.
It's not the subscapularis either.
Nope, it's not under the scapula either. If both these muscles, if one of these muscles wasn't colored, you'd think they were both one muscle. But anyway, what is the muscle?
The teres minor?
Yes, infraspinatus and teres minor. The muscle in red was teres minor, though. You're right. There you go. All right, thank you, ma'am.
Yep.
This one's hard, Miss Cooper, because it's hard to tell what they're looking at. But what muscle do you suppose this is? It is a rotator cuff muscle. This is a rotator cuff muscle, and this is the only way to really access it because it's actually on the anterior side of the scapula. We don't think of it that way because we don't access it this way. But anyway, what muscle is this, Miss Cooper?
Okay, let me break this down in my head real quick.
Please.
Let me remember my rotator cuff muscles.
Cool. Cool. Miss Hanson just said them, but if you say them again, that might be helpful.
Well, I'm thinking.
What are the 4 rotator cuff muscles?
See, that's the problem.
That's
That's
what I
the
thought.
issue. Hold on, give me a second.
So you got one above the spine of the scapula. What do you call that?
The super something.
Supraspinatus?
Yeah, the supraspinatus, the infraspinatus, supraspinatus, infraspinatus. Oh my God.
Anytime I say infraspinatus, you say
teres minor.
yes. So supraspinatus, infraspinatus, teres minor, and what's the last one?
I want to say it, but it doesn't look like it at all.
But what's the last one? I just want you to say the 4 rotators first.
Is it latissimus dorsi?
No. Last rotator's not that. Last one is found under the scapula, and it's kind of named that way.
Subscapularis?
Subscapularis. There you go. So this is one of those 4 muscles. Would you be able to see something underneath the scapula from the front of the body? Well, actually, you might, my dear.
I know it's not the subscapularis.
Why do you know it's not the subscapularis?
Because that's under the scapula. This isn't even. How?
Because, my dear, this will help you. Think about this for a second. Look at the skeleton.
I'm sorry for all your ears, but like how?
Look at the skeleton. Under the scapula is the front of the scapula that you would see from the armpit.
That's annoying.
Well, it's a fact.
Well, it's a very annoying fact.
But now you know it.
Yeah, sure. Cool.
Thank you, Miss.
Now.
Thank you, Miss Cooper. I'm sorry. It is annoying, but that's why we're doing it. All right, Miss Bilotic.
Is that the supraspinatus?
Yes, it is. It's above the spine of the scapula. It's supraspinatus. Goes underneath the acromion process, hooked onto the greater tubercle of the humerus. And you are right. Helps with what action? By the way, this is the one rotator cuff muscle that doesn't rotate. What action do you suppose it creates, Miss Bilotic? If this thing tightened, what action do you suppose it would create? Miss Hanson's doing it.
Adduction?
What kind?
Abduction?
Abduction. Good job, man. Awesome. You're on fire today. All right, I love it. Thank you. Miss Yanez, you got some stiff competition now, Miss Yanez. I mean, they're naming rotator cuff muscles. They're talking about actions. Miss Hanson's doing the actions. Yeah. What is this muscle here, ma'am? Don't blow it. A lot of pressure on you right now. Everybody's looking.
It's either the teres minor or the teres major.
Good. Okay. So you didn't think it was infraspinatus because it wasn't right below the spine of the scapula, right? And she kind of knows teres major and teres minor like to hang out on the lateral border of the scapula.
It's teres minor.
And how did you just figure that out?
Because the major goes under.
The minor rides on the shoulders of the major. That's teres minor. Love your thinking. Thank you. Beautiful demonstration. Really nicely done. Miss Torres. Oh, yeah.
Yes.
Just 1 second, Miss Torres. Yes, Miss Hunter.
Did you say the subscapularis abducts?
No, I said the supraspinatus abducts.
Oh, the supraspinatus abducts?
AB ducts, pulls away from the body.
Oh my god. I'm sorry, but the way it looks like it just does elevation. No, it can't do that. I don't know what it does. Oh my god.
If I took a little like needle and thread and sewed it into the outside of your shoulder here, and then I pulled on this, your arm would come up. That's an abduction.
Oh, okay. Now I understand. All right,
Cool.
thank you.
No, that's awesome. All right, Miss Torres, what I'm assuming this is. By the way, there won't be pictures like this where we don't know what they're talking about, but on the test. But I'm assuming they're talking about an entire muscle group here. Miss Torres, what is this muscle group?
The erector spinae group?
Yeah, I think that's what they're trying to tell us. The rectus
No?
spinae group. That is. You're right. Yes. Yes. All right. Miss Stanley, what is this muscle or muscles?
Rhomboids major and minor.
Thank you. Which one's on top?
Minor.
Minor right on the shoulders, the major. She's exactly right. What two muscles argue with the rhomboids major and minor?
I don't find this funny.
I find this very funny, actually. Anyway, what two muscles argue with the rhomboids major and minor?
So it was serratus anterior, right?
It was serratus anterior is 100% correct, yes.
Why have I already forgotten the other one? Don't tell me. I'm thinking. Like what? No, wait, no. Yeah, I don't know.
You don't know what goes with the serratus anterior?
What do you mean what goes with it?
What goes with the serratus anterior and works with it? Sorry, I'm kind of itchy right now.
The pec minor.
Pec minor goes with it. Pec minor inserts into the coracoid process in ribs 3, 4, and 5, 3, 4, and 5, and helps to protract and depress the scapula. Good job. Serratus anterior and pec minor. Everybody, I've mentioned that 35 times since you started working. So that's not me scolding you. What I'm telling you is if I mention it 35 times, it'll probably be a question, right? Just giving you a heads up. Cool. Good job, everybody. Do we have time? Of course we have time. Miss Petrie. Let's see what's next. Miss Petrie, you might get two. What's this one first? It's half a muscle.
Okay, that would be the.
It's not a great
Give me a
picture.
second.
Pec major or minor?
Oh, that's the trapezius.
It is. Good job. I was trying to mess with you. Like, you better
I
not pick
know.
either one of those. Good job. It's half a trapezius, and it's just not a very good shot.
Yeah.
Okay. What is this, Miss Petrie?
Okay, that would be. Hold on. Connects to the border
Yes.
of the scapula.
The medial
up next
border
to
of the
the
scapula.
occipital. Yeah, the medial border of the scapula up into the occipital.
Yeah, it
Or
actually is.
no, that's not even the occipital.
No,
That's
it's
like
the transverse processes of cervical 1 through 4.
Hold on. Medial border That's the mastoid process, right?
Mastoid process. The mastoid process is up.
No, I'm saying it's connected to.
No, it's connected to the transverse processes of C1 through C4. You can't see it in the picture, but I'm telling you right now it is.
Oh, okay.
But what's more important is when you go up the medial border of the scapula, you've got rhomboids major, rhomboids minor, and then this muscle on top of the rhomboids minor. It's attached to the medial border up by the superior angle of the scapula. What action do you suppose this muscle might do? Maybe that'll help us. What action would happen if this... Oh, this muscle might elevate the scapula. Yeah, that's a good guess. I think you're right.
Would that be the levator scapula?
Oh my gosh, what a great idea. We can name it by what it is. And you are right. So I know I was being a smart ass there, but also it gives you a way to kind of look through a test, right? When you're getting stuck, just kind of think like, what do I know about this thing? And literally, with all due respect, you might have known nothing, but you knew it was running up and you knew it was hooked to a scapula and you knew it was going to lift it. And that might give us the answer in a multiple choice test if they had levator scapula. Good job. I love your thinking process. I really do. Miss Peach. Oh, Miss Nguyen. Oh, we get to see your face now too. I feel so lucky. Let's see. Miss Nguyen, what muscle is this? It's not a very good picture, but it's, do you know what it is?
That and trapezius.
It's trapezius. Okay. Miss Nguyen, what is this muscle that's coming out from behind the scapula? This muscle is actually attached to the medial border of the scapula. It actually touches the rhomboids. It argues with the rhomboids. I talk about it all the time.
Anterior, I think.
Yeah, I think you're about to say it.
Yeah, anterior, but I think in the scar. I don't know how to say, but I know in the anterior and scar.
Tuss.
Okay, scar a tuss is the anterior.
Serratus anterior. Finger-like projections coming down on ribs, first 8 or 9 ribs. It's actually coming out from behind the scapula, everybody. It actually runs underneath the scapula and hooks to the medial border of the scapula. This is one of the muscles that argues with the rhomboids, right? Oh, Miss Stanley, what was the other muscle that argued with the rhomboids? I forgot. No? Not going to do it?
The pec minor.
Thank you, ma'am. I appreciate it. All right, good job, both of you. Miss Moore. Miss Moore, what is this? Might be the last muscle we do today. What is this muscle, Miss Moore?
Pec major.
Pec major. Yeah, it's huge and it goes over to the humerus, everybody. Do not confuse it with the pec minor. I could see questions on the test about the difference between the pec major and the pec minor. Pec major moves my arm because it crosses the glenohumeral joint. Pec minor does not cross the glenohumeral joint. It hooks to my scapula in front, and it moves my scapula. That's it. Cool. Good job, Miss Moore. Good job. All right. Oh, shoot. Sorry, everybody. Boom. Let's see here. Do we have time for one more? Oh, why did we show the pec minor? Well, that's it. We're stopping there because we're giving away